A big thank you to all of our trusted media partners, and I will now turn the floor over to Dr. Wong.
Thank you, Chair Redmond. Morning. So we are seeing signs of stabilization or slow improvement in our indicators, such as case rates, hospitalizations, and outbreaks. We have also seen, importantly, our vaccination rates ramp up significantly since being designated a Delta hotspot. Since then, our first dose coverage has increased from 58% to almost 80% of adults. Second dose coverage has increased from 6% to 45% of adults. This is an incredible increase in a short period of time. Because of these factors, I am pleased to let residents know that the region of Waterloo will move into step 2 of Ontario's roadmap to reopening, beginning at 12:01 a.m. on Monday, July the 12th. I must emphasize, however, that it remains very important for each and every one of us to continue practicing public health measures and to continue getting vaccinated. We cannot let up now. For those who have been recently vaccinated, please remember that it takes 2 weeks for your body to build immunity after you receive the vaccine. You still need to remain very cautious in the 2 weeks after receiving the vaccine. Delta is prevalent in our region. It is circulating widely, and it is the most aggressive variant and fastest spreading variant that we have experienced to date. So we need to continue to build on our momentum, doing what we can to slow the spread of COVID-19 through the measures that we know work, such as masking and distancing, getting tested if you have any symptoms, and increasing vaccination rates. This will help Waterloo Region remain on track to move in unison with the rest of the province for step 3. I will now pass things over to Chair Redmond.
Thank you, Dr. Wong. This is the news we all wanted to hear. And I know that delaying the move to step 2 was a difficult one for residents, businesses, and organizations throughout the region of Waterloo. But it was a strategic decision to allow us to be in the best opportunity to reopen and stay open. Our vaccine rollout is working, and this is what has allowed us to move to step 2 of Ontario's roadmap to reopening on Monday. As Dr. Wong said, we have seen our vaccine numbers dramatically increase over the last number of weeks. I want to say thank you to all involved in the rollout of the vaccine, staff, volunteers, as well as hundreds of thousands of residents who have received a vaccine to date. Moving to step 2 is great news, but let me be clear, our sites are now fully focused on entering step 3 in line with the province. To get there, residents need to continue getting first and second doses. Get the first vaccine available to you. Do not wait. We continue to look for new ways for residents to get vaccinated. We have an additional 20,000 vaccine appointments available at Binghamton's this weekend, thanks to our partnership with Bruce Power and the arrival of the Hockey Hub Clinic model. This builds on the momentum over the last few weeks. First dose walk-ins that continue, late night doses at Pine Bush, Red Cross mobile clinics, Binghamton's drive-through, and now this week's Hockey Hub Clinic. Waterloo Region, let's keep this momentum going. Let's get to step 3. Thank you. Lindsay, over to you.
Thank you, Chair Redmond. We'll now open it up to questions from the media. So I'll call on you one by one, and then you can have a question and follow up for Chair Redmond or Dr. Wong. So we'll start with Kate from CBC.
Thank you. Dr. Wong, I just want to ask, with hospitalizations still so high, and we're hearing that it's a lot of young individuals in the hospital and in the ICU. I mean, what did that play in your thinking in allowing us to go to step 2 when we see these young people in hospital and the number is still so high in hospital?
Thanks for the question, Kate. So we are and continue to be in a precarious situation. Sorry, that was grammatically incorrect. We continue to be in a precarious situation. We know, based on what we've seen in other jurisdictions, that when Delta becomes dominant, what you normally see is this, very significant increase in case rates, which then leads to more hospitalizations a little later, and more outbreaks as well. And so what we have seen in our region is we have seen, in the last month that we had an increase in our cases, but now what we're seeing is some stabilization of those rates. So in the face of Delta, that is quite significant. What that shows is that Waterloo Region is pushing back hard against Delta. Yes, we will continue to have pressure in our hospital system for a while, and the case rates will not drop right away. There will continue to be cases and clusters and outbreaks of Delta, but we are pushing back hard. We are rapidly increasing our vaccination rates, and this will exert over time downward pressure on Delta. So we need to keep up, each and every one of us. We need to understand that we're not out of the woods yet, that we need to keep up with our public health precautions, the masking and the distancing, the staying at home when ill, the getting tested when ill, and importantly, getting vaccinated as soon as you're able to. We need to keep those things up as we cautiously move progressively through the reopening stages. Getting up our vaccination rates, will be the thing that will allow us to continue moving forward in the reopening. So what we're seeing, Kate, is not unexpected, but it just shows that we need to remain very cautious, and we need to continue to push back against Delta with everything that each and every one of us can do.
Thank you. My follow-up is, there was such a demand for vaccinations, and at this point, getting those first doses might be a little more difficult because it's the people who just don't want to or don't care. And I'm wondering what that looks like from a public health standpoint. What do you do now to encourage those people who are saying, I don't need to get vaccinated, everyone around me is vaccinated? What do you do to get those people in to get their first dose?
We're not gonna stop trying, Kate. We're gonna keep working to make vaccinations easier and more accessible for people, continue to have conversations with people, continue to provide information. We have excellent family physicians, pharmacists, other healthcare providers in our region that are also helping to provide that information and answer questions from residents, but we're not going to keep going. We're not going to ever say, okay, we have enough of our residents immunized, we can carry on now. We're going to keep going until we can no longer keep going. We are going to try to get vaccinations available and accessible everywhere that we can, and information to people who still have questions as much as we can to break down all the barriers that we can.
Thank you, Kate. Nicole, CTV.
Hi, vaccination rates are a key component to getting to step 2 and step 3. This morning, the province announced that they are at more than 50% of second dose vaccination rates. But here in Waterloo Region, we're still at 45. After this weekend, are you hoping to be at that 50% mark? What will it take to be on par when it comes to getting our residents fully vaccinated with the rest of the province?
Yes, since we've been able to get more vaccine, we've been able to open up many more spots. And you can see with the Biggamins event, we're opening up, a very high number of additional spots. And we really need people to try to complete their series as soon as they can. And right now we have lots of availability for that. So we are strongly encouraging people not to wait. If they're eligible for their second dose, get their second dose. And we have the spots now available. We really need to as a community, try to get the best protection as fast as we can. We are a little, our rates are still catching up a little bit in terms of second rates, but we are actually ahead of the province in terms of first doses. We are still seeing some demand for first doses, which is encouraging. And we're also a little ahead of the province in terms of doses for youth and doses for the younger age groups, like those from 18 to 29. So those are encouraging signs. And overall, we have rapidly increased, and our goal is to continue to build on that momentum and continue rapidly increasing, so we can get as many of our residents fully immunized as quickly as possible.
My follow-up has to do with the fact that typically a trend during this pandemic is that we've seen a spike in cases after a holiday or a long weekend. Given that there was Canada Day last week and many people went camping or spent time with family, are you concerned our case rates may keep us behind in step 2 or pull us back if they go up?
Well, right now we are going to move to step 2 Monday morning. We are seeing increased cases yesterday and today, and it may be due to the Canada long weekend. We have consistently seen after every long weekend and holiday that there is an increase in cases. So I think that reminds us of the importance of continuing to really be careful and diligent with our public health practices, even if we've been immunized, right? Because of the Delta circulation, we need to exert a lot of caution. And of course, if you haven't gotten your first dose, or you haven't got your second dose and you're eligible for your second dose now, please come and get it. We have lots of spots available for you.
And I'm just going to jump in partially to Kate's question and Nicole, partly to yours, and that's to say we know Delta is throughout the province. It's global, right? We can look at the UK example. So getting more people vaccinated is good for all of us. It's good if people in Hanover are getting vaccinated. It's really important that we continue to get vaccinated. But we know people aren't, they're waiting to get out. They're waiting to move around. So the context, our goal is to get as many vaccines in arms now because we have the vaccine, but we recognize that the Delta variant is everywhere. So people can't sort of feel like we're in a bubble in Waterloo region. It's great that people are stepping up and putting the community good above their personal preferences maybe, but Delta's everywhere.
Thank you, Chair Redmond. We'll move on to Robert from Rogers TV.
Hello, thank you. Good morning. So with Waterloo Region being a Delta variant hotspot throughout the province, are there different factors that Waterloo Region needs to meet in order to reach step 3, or are we just looking to stay along the same factors as every other health network across the province?
Thank you for the question, Robert. So we have to continue to see signs that our situation is stable and not deteriorating. And we need to continue to see a rapid increase in vaccination coverage in our community. Those are the same factors that we look to see to move to step 2, and that will be the same for step 3.
My follow-up is I've been seeing a lot of complaints on social media and hearing from a lot of people out in the public that we've already met the criteria to be in step 3 already. Why aren't we there already? What is your message to those people who feel that we should be in step 3 already, even though we've met the criteria, but we haven't waited those 21 days?
Thanks for the question, Robert. So Ontario's metrics for reopening and going from one step to the other were never only about vaccination rates. Those vaccination rates were also set at a time when we were faced with Alpha. Delta is a much more transmissible and aggressive variant. And so the thresholds were never only about vaccination. They were also about public health and healthcare system indicators. They had to be, moving in the right direction. At the time that we decided to temporarily delay going into step 2, we had been experiencing a deterioration of those indicators. So, continual movement forward in the steps isn't just about vaccine coverage. It's about control of the Delta variant, as well as increasing vaccination coverage. And really the purpose of that is to keep us moving forward in our reopening and not have to take a step back. We have seen with Delta in other jurisdictions, other jurisdictions have had to take a step back. We see what's happening with Delta in places like the UK, Israel, Australia. These are important lessons for us about the aggressivity of Delta and the importance of taking a cautious approach to reopening so that we don't have to end up going back. So the 21 days, was really something that was based on scientific advice to make sure that the cautious approach that we're taking in Ontario isn't, will allow us to continue to reopen progressively, and again, not have surges such that we'd have to take a step back. So it's that the people remember only the vaccination thresholds, but it's only one component of what is required in order for Waterloo Region and Ontario to keep moving forward.
Perfect, thank you.
Joanna.
Thank you. A couple questions for Dr. Wong. When you delayed us moving forward into step 2, you had originally said mid-July. Is Monday about the date that you were thinking, or is that a bit earlier?
No, it's approximately a couple of weeks. We needed that time to, continue to do everything we could to stabilize Delta transmission in the community, as well as importantly, get those additional vaccines into arms and allow some time for the vaccines to take effect, right? Because it takes a couple of weeks for people to build immunity after they've received a shot. So that's why, we were looking at a couple of weeks. And, since the decision, we've seen that there's been some stabilization in our indicators and that our vaccine coverage has significantly increased. So those are all positive signs that are, showing us that we're on our way. We just need to keep up this momentum, so that we can keep each other safe and continue reopening.
And then a question for a colleague. Data shows that the region has about 80,000 doses that have been stored since June 23rd, which is a lot more than normal. Is there a reason why we haven't been able to get those vaccines out when it's been sort of urgent to get more people vaccinated?
Yeah. We publish weekly inventory numbers on our website, and the dates don't necessarily correspond, to when we had the vaccine. So usually we get a significant influx in the few days before those numbers are published, and those are doses that are meant for the upcoming week. So, since we've gotten increased supply, we have been increasing the vaccine output, and we have been opening up more spots, and we have been, increasing the venues at which people can get a vaccine, and we're having this significant event that's coming up this weekend in order to make vaccine even more accessible for people. So, it's important that we got the additional vaccine, and with the additional vaccine, we're making it easier for people to get their shot through multiple venues, and it's working. People are getting their shots, and we're going to continue on that trend to continue getting out vaccine, quickly, and offering more accessibility and more opportunities for people to get vaccinated.
And if I can just add to Dr. Wong's answer, Joanna, we went to the province and asked for a vaccine, and they've certainly delivered. We also asked for more resources, and while we got some, we didn't get as many as we needed, which is one of the reasons why we partnered with Bruce Power and the Hockey Hub model, because one of the stress points is not burning out our staff and our volunteers and having enough to draw the vaccine as well as put shots in arms. So,
yeah. Suddenly getting double the amount of doses is wonderful, but it does take a little bit of time to put everything together so that you can get it out as quickly as you can. And we've been continuing to increase accessibility and opportunities for our residents to get vaccinated.
Thanks, Joanna. Alex, if you have any questions.
Yeah, so obviously the big push is for vaccinations at Binghamton's is great, but for a lot of the more rural communities, especially Woolwich Township, we have a lot of Mennonites here, and the way that they get around is through like horse and buggy. So are you guys thinking of doing anything in this region for that for those communities?
Hi, Alex. I can tell you that healthcare partners that normally work with this population and ourselves have been working on this with the Mennonite population for months, and we continue to work on this. And we continue to have conversations on the best way for them to receive the vaccine. It may not be the same way that people elsewhere would want to receive it. And so yes, so there's been outreach ongoing for months, and there continues to be a lot of work by multiple partners in these areas, whom the Mennonites generally seek services from, to get the vaccine out to them.
Awesome. And just a quick follow-up would be, how has the reception been in that community? Have you found that, there's a lot of vaccines going out into arms?
In that community, I think we just, we need to make it as accessible as possible, and to, answer questions that they may have. It remains an individual choice, Alex. And, we just have to make sure that when we offer the vaccine, we try to break down all possible barriers and continue to encourage them to increase to increase vaccine uptake.
Thank you.
Thanks, Alex. We'll move on to Matt from Global News.
Hi there. Sorry about that. I'm just wondering if you could clarify one thing for me. When you say that you want to move into step 3 in line with the province, are you saying that you would like to do that on that sort of July 21st day when the rest of the province is moving into it, or do you want to go 21 days after Monday? And if that is the case that you're looking to go with the rest of the province, I'm just wondering how you can sort of justify the rhetoric that you're using of extreme caution while moving through 2 stages in about a week and a half span.
Sorry, is your name Matt? Sorry, Matt?
Yeah, that's correct.
Okay. No, thanks for the question, Matt. So the criteria that I was looking for to have us move to step 2 and continue moving through the stages of the reopening were indications of stabilization of our situation with the Delta variant, and 2, increasing vaccination rates. So those continue to be the criteria that we're going to be looking for in order to determine when we can move to step 3. We want to, if we can, continue to move to step 3 when we can, and if we can, align with the province as well. Delta is prevalent in our community, and we know that we will continue to have cases and clusters of cases and outbreaks for some time. This will not go away quickly, but we do know that we can slow the spread of Delta, and we can stabilize our situation, and with the increased vaccination, we can be overall in a situation where we can continue to move forward in the reopening. So that's why it's important for us to not let up now. That's why it's really important for us to understand that it's in our hands, right? And we can do this. We can continue to get vaccinated. We can continue to be cautious with our public health precautions, and we can continue to move forward this way. So it's about continuing those measures that we know work and that eventually will put downward pressure on Delta and allow us to overcome this.
And just to follow up, the remainder of the province rather is largely looking at Waterloo as the sort of benchmark for how to control the Delta at this point. I'm wondering what kind of advice you would have for other regions who are looking at the rise of Delta and this slow and steady approach going forward.
Yeah, thanks for the question again, Matt. So yes, we are in regular conversations with the province. They are looking at what's happening here, as well as the evidence now that we have from other jurisdictions like the UK, Israel, Australia. Delta tends to increase case rates significantly, leads to surges. We have been pushing back and battling an increase in Delta in our region. It hasn't been explosive like it has been in other areas, right? It has slowed down, although it's slow. It has slowed down in the last couple of weeks. And indicators are showing some signs of improvement, as well as the stabilization that I mentioned earlier. And so it is a sign that we are actually moving in the right direction, because we are stabilizing rates as opposed to what we've seen elsewhere, which can be quite explosive. And so that is a good sign. And we know that the higher that we can get our immunization rates, the more there will be downward pressure on our Delta. So that's why we have to keep pushing on that. And we also have to make sure that our residents are aware that even though we are moving in the right direction, and we will eventually overcome this. We need to keep up to best help our community. We need to keep up with our public health precautions as we go through this, because what we see in case and contact management, all our recent cases, when we put the picture together, what we see is the same thing that we have seen all through this pandemic. It's not any different. Most of the time, people are catching this through close, unprotected contact, right? Except that Delta spreads a lot faster than any other variant before, and it's making people sicker. So it's the same measures that we have to apply to slow Delta, right? It's the same understanding that we need to keep up with those public health precautions, and that we can each play a role in that in order to slow the spread. What we see with Delta, we have one case and it suddenly becomes 10, because that's how quickly it can spread. So if each and every one of us continue not only to get vaccinated, but keep up with those precautions until we can get really high vaccination rates in our community, we will help our community by continuing to push back on Delta and slowing its spread.
Thank you, Dr. Wang. Kevin, do you have any questions?
Yeah, so case counts here and hospitalizations rates here remain pretty high still. What sort of indicators did you look at in making this decision?
Yeah, so the indicators were the usual public health and health system indicators that we look at. Well, there are case rates, number of active cases, reproduction number, hospitalizations, ICU admissions, outbreaks, and trends in terms of how they're moving, right? Normally, when you have these Delta surges, you have significant surges, right? For some perspective, when we were at the height of our pandemic rates in Waterloo Region, it was during the second wave. We were at approximately 200 cases per 100,000 per week. So we were very, very high. We're now at approximately 55 cases per 100,000 per week. So while it's definitely much higher than we'd like it to be at this time, it is still showing that we are exerting downward pressure on Delta, because we did rise earlier last month to close to 80 cases per 100,000 per week. So we are slowly exerting downward pressure on Delta, and so that's a sign, right, that we're moving in the right direction. And we do know that Delta is more aggressive. It's making people sicker, and when we have an increase in case rates, it's followed a couple of weeks later by an increase in hospitalizations, right? And so we do know that the pressure in our hospitals is a result of the spread that has already occurred. And there'll continue to be pressure for some time because we are still seeing spread. But we can and are slowing the spread over time. And that's something that we can all participate and help with, right? Through the public health precautions that we're each exercising and continuing to get vaccinated and complete our series as soon as we can.
So going forward, are we sort of we're essentially now just going to be moving along with the province as it moves into whatever next steps it takes with regards to recovery?
That's what we'd like to do, yes, but we need to keep up with our vaccinations and we need to keep up with our public health precautions going forward so that we can keep applying downward pressure on Delta.
Thank you.
Thank you, Kevin. We'll move to Max from CTV, please.
Hey, sorry, I'm good. I'm following along for web here.
Awesome. Thank you. Casey at 570.
Hey, sorry, I'm good. My internet cut out for a while there, so I'm just gonna have to go back and see what I missed. I don't want to double back on anyone.
Thanks very much. Well, thank you very much, everyone, for joining us this morning. We really appreciate everyone taking time out of their calendars to join us for this announcement. Thank you very much.
Take care, everybody.
Thank you.
Thank you.
Take care.